Hello, welcome to our series. This program, the Foundation for a Successful Retirement Income Plan, requires that all the pieces work together well. We're going to review now our Medicare series. Just like to remind you that myself, Realistic Economist, are not affiliated or endorsed by any government agency. This program is designed to be strictly educational in nature. This multi-part program is based on two of my books, the 2016 Social Security book and the Survivor's Guide, Medicare Rules and Regulations, and will include excerpts from my programs presented at William Patterson University here in New Jersey. Just a little bit about me. You can read in the handout that's in your packet. This particular program will be very light on the handouts because it will include two of my books. Which are pretty depth. There's a lot of material in there, so we're going to be a little lighter on the handouts. I just want to let you know this will be the most straightforward educational program that you'll ever receive. And a lot of folks ask me, why is this program different than others? Well, number one, I'm certified by the National Social Security Advisors. I've written 7 books, including the book on Social Security and Medicare. There's no free consultations, come into the office gimmicks, buy part of this or buy part of a program. There's no free meals and there's no sales pressure. What we have is a program that's specifically or going to be focused on Medicare, eliminating the 5 risks and integrating Social Security decision into that program. What's important here, we divided it into 4 different videos, so you can start and stop or replay anyone as you like. Just if you can, don't leave me on pause too long because I do get tired from standing. We have a Q&A session by email, so if a part comes up, you're not 100% sure, you want some clarification, that's what the email system will be used for. Education rules as I go. As I normally say, this event will be divided into 3 parts. Number 1 are the video classes that you are taking. There are going to be 4 segments. They'll include any kind of numbered email handouts. Part 2 is the PDF of my Survivor's Guide book, which is very important. And last but not least, there is that I kind of believe this ties it all together very well. It's the Social Security and the Medicare cost analysis. It's actually a nice report. This is where you see the strategies in real time. The nice thing about it, from an older guy, I enjoy the technology, is you actually log right into my computer and you see your report created live, and we're doing that while we're talking on the telephone. So I think that's a pretty exciting thing. Once we finalize it, the report is saved and it's emailed to you as a PDF. Basically, how I designed the videos, they are to be followed in sequence, obviously 1, 2, 3, 4. I designed each sequence to be approximately 15 minutes, and it basically helps to keep you awake and also gives my voice somewhat of a break. Again, if you need to ask any questions, my email is joe@realisticeconomist.us. Okay, let's get started. Healthcare, Medicare, Medicaid, and staying healthy, which is today's program. Okay, let's do a little quick history lesson. There are 2 important dates, 1935 and 1965. Legislation, obviously 1935 was the beginning of the Social Security Act. 1965 was the beginning of the Medicare Act. But basically what happened is Title 18 was an amendment to the Social Security Act, and that became known as Part A and Part B of Medicare. Title 19, again, that was an amendment to the Act of Social Security. That became known as Medicaid. Now, the interesting thing with this part, it provides for the states to finance health care for individuals that are close to a public assistance level with federal matching funds. The important things to realize here, what the impact is the states contribute part of the money for this program. They get some matching funds from the federal government and they pay. Now, all I can tell you is this much. Many states are in dire straits for dollars. I'm not saying they're all bankrupt, but they're very, very close to it, especially New Jersey. So the cost is putting a huge burden on their programs. Now, the interesting thing is we're going to learn a little later on that a lot of these programs that put costs to the state has a way to come back and collect the money back. So we'll learn a little bit toward the end how sometimes this program may seem like it's a kind of a gift. Actually, it can come back to haunt a lot of folks. Now, Medicare was part of the Great Society program. I'm sure a lot of us are alive to remember when that was signed on July 30th, 1965. Again, that was part of Medicare and Medicaid. So I do have a question for those who may be a little bit of history buffs. Who was the first person to sign up for Medicare? Now, if you were there, or if you remember some pictures, you'll know that former President Truman was at LBJ's side when he was signing the legislation. His wife, Bess, was the second person to sign up for Medicare. So what did they pay? What was their first or Part B premium? And a lot of folks will kind of throw guesses out. In some of the live presentations, it actually was $3. What I try to warn folks with is that I call it health happens. What you don't know about healthcare and retirement will make you sick. It's really important that we understand not only Medicare and healthcare, but the cost associated with these programs in relationship to how our Social Security works. Again, the successful basis for any retirement income plan requires that all the pieces work together and they work together well, which is very important. I want to give you a crazy fact. In order to collect Social Security benefits, you must enroll in Medicare once eligible. If for some reason you decide that you want to opt out of Medicare Part A, that would render you ineligible to collect Social Security monthly income payments. And basically, if you already started, let's say maybe you started at 62, what would happen is you would have to reimburse or refund all the money you've gotten in Social Security all those years because you didn't sign up for your Medicare. So what they're basically saying here is Medicare is mandatory. Whether you like it or not, you've got to take it. If you don't want to take it, that's fine. But then again, you can't get any Social Security, monthly income payments. Let's do a quick pop quiz. If you remember from the one on Social Security, because we asked the same question, how many parts does Medicare have? Medicare has 4 separate parts. Here are the parts. Part A, which is hospital insurance. Part B, which is medical insurance. And many times they're referred to as original Medicare. So if you hear the term original Medicare, that is your traditional Part A and B. There's also Part C to Medicare, which is your Medicare Advantage plans. It's been around for quite a long time in different word formats, but the Part C has been around for quite a while. And then you have Part D, which is your prescription drug coverage. Now, what happens with Part C and D? Part C and D are a little bit unique in that they're a little different than your traditional Medicare A and B, because sometimes it's possible that if you take Part C, you don't need Part A, B, or D. So you look at them, it's not 4 parts, you need each part, but they do kind of work together, and sometimes they actually work against each other. Here's where some of the confusion starts. We all know we have original Medicare. If you have parents, they're probably very familiar with Parts A and B of Medicare. That's been around, obviously, since 1965. Medicare Advantage plans, which have been gaining a lot of popularity. What the difference is here is inside the Medicare Advantage plans, there's different type of plans. There's your managed care plans, your PPO, preferred provider organizations, private fee-for-service plans, Medicare specialty plans, and interestingly, some of those plans may include drug coverage. And then we have, lastly here, we have the Part D, which basically continues the confusion because that is your prescription drug coverage. Now, Medicare for this year, you have to be 65 or older, and you need to be covered under your Social Security. If you have 40 quarters in, the cost for your Part A, or it's called HI as well, health insurance, is zero. Now, other folks can be or get on Medicare if they've been disabled for 2 years, they have end-stage renal disease, or ALS, which is Lou Gehrig's disease. Part B is called Supplemental Medical Insurance. If you ever hear the term SMI, they're referring to Part B. Now, interestingly, the cost is different for everyone, and the costs are rising way, way faster than inflation. For this year, Medicare has some deductibles, as you know, or as you soon will know. They have a deductible for Part A, and the Part A deductible is $1,288, and that is per benefit period. And I ask the question a lot of times when I do these presentations live, how many deductibles can you have in the course of a year? Now, if folks were familiar with Part B will give you just one deductible a year. Or if you're familiar with your group health insurance, you'll pay your deductible and you're good for the entire year. The difference is with Part A of Medicare, your benefit period is 60 days. So technically, if you're in the hospital for 60 days, you get released and you go back in again for 60 days or even for 2 days. Your deductible is $1,288 for the first spell of illness. You get out, you're going to pay another deductible again. So it's technically possible, if you stretch the calendar and you spend the entire year, but you get a day off in there, to get about 5 or 6 deductibles for a course of a calendar year. So it's very important to understand that your deductible is per 6-month or 60-day period, and it could be multiple deductibles in the course of 1 year. If you, God forbid, in the hospital for longer than 60 days, there's a copay of $322 from the 61st to the 90th day. There is also a payment of $644 if you're in there from 91 days to 150 days. Now, when we look at Part A also covers what they call a skilled nursing facilities. Simply what that means is your cost to use that facility is zero for the first 20 days. After the 20-day period, there's a $161 copayment from the 21st day to the 100th day. What that means is after 100 days, Medicare Part A no longer pays for any skilled nursing facility care. Interestingly, Medicare supplements will not pay, or Part B rather, will not pay anything after the 100 days. So I usually ask the question, does an SNF, that's the abbreviation they use for skilled nursing facility, does it cover custodial care? And the answer is no. You have to be very careful. We're going to learn a little later on the difference between rehabilitative care and custodial care. But for the time being, that it does not cover any kind of custodial care. Part B is your, I'm going to call it your doctor visits and your medical equipment, that type of stuff. Your calendar year deductible, different than your Part A deductible. The calendar deductible for Part B is $166, but it's one time for that particular year. At which point you have about an 80-20 cost difference in there. But what you have to realize is it's not a fixed 80-20. It could be more. You know, some doctors could actually charge an additional 15% over a Medicare approved amount on top of the 20% you're already paying. So basically, that extra 15% they call a limiting charge. So together, between that and the 20%, you'll be paying about 35% over Medicare approved amounts for a certain type of care with certain type of doctors. So it's important to understand it's an 80-20, but with only certain doctors. You have to be very careful if your doctor is not in that particular program. Now, as we're going to learn, Medicare has gaps, and they have deductibles and gaps. So shortly after Medicare was passed, legislation, Medigap policies were started. Now, many times you'll hear the term Medigap, Medicare supplements, or supplement plans. They all, unfortunately, refer to the same thing. It's picking up where Medicare leaves off. It's a separate policy, so don't get confused. Well, when we look at Medigap, we're going to look at the different plans. Now, let's look at the next slide and we'll get a little better feel for it. Medigap policies or Medigap plans, there's a total of 10 different plans that the federal government sets up. Now, they are sold by private insurance companies or private companies, but not all companies will sell the same 10 plans. They may sell 3 of the 10, 2 of the 10, or 8 of the 10, or actually 10 of the 10. So it's very important to understand that not all insurers will sell all the plans. And the prices vary widely. And sometimes it's hundreds of dollars between one company's plan and the next. So be careful, and we're going to learn a little bit later on. We basically need to shop very well. A lot of folks will ask the question, I have a health plan through my employer. Most employer health plans that you've kept after retirement become secondary to Medicare, and they kind of act like Medigap policies. But the only thing is a lot of companies, a lot of employers can drop those plans in the future if they become too costly. Now, when we start to look at Medigap plans, we're going to take for a second a looking at the $322 copay and the $644. What happens here? We know that after you pay your deductible of the $1,288, at which point at the 61st day, you've now got to pick up new charges. So what happens is simple. Your Medigap policy or your Medicare supplement, if you have one, will now kick in and pick up the difference. Now, what's important, and we could literally make an entire program on Medigap plans. We're going to give you a very quick overrun, but you really have to read well. The state of New Jersey, and I have the software that'll kind of break it down for you. So if you need that kind of help, I'll be more than happy to do that for you. But what you have to do is be very, very careful. Medicare, we're going to read off the chart, Medicare Part A coinsurance, I underlined it in red, and hospital costs up to an additional 365 days after Medicare benefits are used up. What it's saying here, if you look at the top, these are your Medigap plans, A, B, C, D, E, A, B, C, D, F, G, K, L, M, N. What they're doing, they drop plans, they add new ones, and they just keep giving them different letters. But if you look where I circled, you'll see that plan A through N all cover that benefit. And here's where a lot of people get tripped up. You know there's a deductible of that $1,266, I believe. So you're thinking, oh, my plan A covers it. But if you scroll down and look where it says Medicare Part A deductible, and I underline that in red, you'll see that plan A does not cover that. The difference is Part A covers the coinsurance. So basically after that 60 days, then they'll pick up that payment. So be very careful when you look at it and say, hey, great, I'm going to take Plan A because it's cheaper, and they cover those deductibles. And the answer is it does not. Now, you'll look here, if you're Plan A through N, Medicare B, coinsurance and copayment, you'll see that all the plans cover that. Plans K and L will cover it at 50% and 75% respectively. Interestingly enough, as you go down the list, you'll see what each plan covers. Now, understand this, it's important. All insurers that are selling Medicare supplement plans must cover the same basic things. It's important. The difference is some plans, the same letter, may cover more things with one insurer over another, but they all have to cover the same basic items. Now, if you go down to a Medicare Part B deductible, it's underneath, kind of highlighted in the yellow. You'll see there that's the $166 deductible, and you'll see that Plan C covers it. So, and also Plan F covers that. So I'm not going to spend a lot of time with the chart. It's important. You can get those charts anywhere. You can look at the screen. Understand that each specific letter or each plan covers things a little differently, and be very careful when you read, and don't assume, like we did on the first item, that the Medicare Part A coinsurance is the deductible. It's not. It takes place after the deductible. Now, when you look at other things, as you go through the list, you'll see Plan K and L will pick up only 50% and 75%. Again, you're going to check your Part A, Part B, excess charges. The excess charges are that 15% charge, or if your doctor is billing over the amount that Medicare approves. Only two plans pick that up, and that's Plan F and Plan G. Now, when you're looking at a Medigap policy or Medicare supplement, you really want to look at a few simple things. We know that there are deductibles and coinsurances involved there. There are really 6 key gaps. 1 are your deductibles for Part A and B, cost of extended hospitalization under Part A, coinsurance on doctor services and outpatient care, cost in excess of Medicare approved charges, most self-administered prescription drugs, and again, nursing home costs. A lot of folks will ask, Joe, what is the most popular program? Now, unfortunately, it's Part F, which happens to be the most expensive, because Part F will give you the most amount of coverage. If you look, Plan C is next, and that has about 21% of the market. Plan B is not Medicare B, it's just the Medicare Supplement Plan B. That's at 5%. Plan D is at 5%, and all the other plans make up about 9%. What the difference is basically Plan F is the most comprehensive plan out of everything. It covers pretty much mostly everything. So for all intents and purposes, if there were any hospital bill that exceeded it, your Medicare supplement would pick it up, Plan F. Any doctors, everything would be picked up. So technically, your total out-of-pocket cost for that particular illness would be close to zero. Important, again, to shop around. This is just a little gap between a 65-year-old woman with Plan F could be $869, or it could be up to $5,295. So that's a huge gap in there. So when we talk about Medicare supplement plans or Medigap plans, it's massively critical that you really shop and understand what each plan covers and it doesn't cover. This is the end of video 1, and let's do a quick review. What we learned a little bit is what to expect in the program in its 3 parts. We had that quick history lesson, that the states are hurting for money. We learned that crazy fact that you have to be in Medicare to get your Social Security. We reviewed the 4 parts of Medicare, your deductibles, co-pays. We also touched on doctors' limiting charge. And I want to stress again, it's important that you shop, 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 shop. Hi, I want to congratulate you on completing part 1 of your video series. I'm excited. I hope you take advantage of the Q&A that's involved in each particular section. Very important to clarify and keep your questions answered quickly so you can go on to the next section without having any open questions that aren't answered. So please do that on the Q&A. Thank you for watching this part and looking forward to seeing you at the end of section 2. Thank you.